Welcome back. In this session, what we're going to look at is chronic inflammation. This is kind of a newer diagnosis in medicine. And so I wanted to give you a heads up on how chronic inflammation and nutrition are tied together. Chronic inflammation is sometimes referred to as the silent killer. It really, unless you get tested for markers, you may not know that you even have chronic inflammation. So as we go through, we'll talk about some of the markers and then looking at some of the aspects of what could increase or decrease the chances of getting chronic inflammation. So there's a difference between acute inflammation and chronic inflammation. Acute inflammation is something I'm sure you're familiar with. It's when you bump your arm and your arm starts swelling up, and it may get red and get a little hot, but then it resolves itself and goes down in time. Whereas a chronic inflammation starts out as kind of an acute type of inflammation, but the difference is it has an ongoing stimulus, something that's continuing to cause the immune system to react, and it has a repetitive cycle that doesn't resolve itself. And so therefore you basically have long-term inflammation that can cause some long-term damage to tissues and result in diseases that we see today. So chronic inflammation is a very important aspect of medicine now. As you see here, chronic inflammation can result in a lot of different issues in your body, and it has been related to all of these things. And it's caused by things that can result in inflammatory action by your body. It can also be caused by aging, and sometimes referred to as inflammaging because it goes up as people get older. But you can see how many different things that can result from chronic inflammation, and so it is an important disease. And we'll spend some more time talking about its relationship to heart disease later on. But I wanted to give you an understanding of what it is in this session. So chronic inflammation is long-term inflammation, all right? And it can happen for months or years, and once again, you may or may not, you may not know you even have it unless the doctor tests for it, and we'll talk about how they can do that. But it can have many causes, but in the long run, it's an inability of your body to resolve that inflammation, and so it just continues and continues. So several factors that can cause it, as you can see on there, the mitochondrial dysfunction, different things, oxidized lipoproteins, but we'll also talk about how its relationship to heart disease, because we'll get some oxidized what we're going to call LDLs that can result in stimulating the immune system and then continuing to do that, leading to plaque formation. But also it can lead to type 2 diabetes and those kind of things. So we'll talk about that as we go through. So there are several risk factors for chronic inflammation. I've just noted a few, and that kind of deal with nutrition, but also the increasing age. As you get older, things change and you get inflammaging, but obesity, high saturated fat, high sugar, oxidative stress, and I'll introduce that in a little bit, all contribute and all have a relationship to nutrition and how nutrients affect this. Testing C-reactive protein, that first one, CRP, is one of the more common tests that they can do. It's a pretty easy test. They can do a blood test. And I would highly recommend that if you get a physical or if your parents or grandparents get physicals, if their physician has not run a CRP, then they might request having one run. But these tumor necrosis factor, the TNF, the interleukins, IL-1 beta, IL-6, IL-8, all are related to what are called markers, or these are things that are present when chronic inflammation is present. And so they are, the interleukins are like cytokines that are important for mediating inflammation, and they will recruit, things that will try to solve the inflammation. So these are referred to as markers. So they are indicators that yes, indeed, there you do have chronic inflammation. And so this is kind of a little bit more sophisticated picture of what we saw before. As on the left, you can see acute inflammation. You can see the phases, where it's very similar to the chronic inflammation on the right, where you produce the inflammatory cytokines, and then, but in acute, as you know, as you notice at the end, you end the stimulus and healing, whereas in chronic inflammation, uh, the pro-inflammatory things are still occurring, and so the body cannot resolve that inflammation, and so it continues to send out these markers, these cytokines to try to resolve it, but it's not happening. And so you just have a repetitive cycle or repetitive process of your immune system trying to resolve this inflammation, and it's not doing anything. So this is an issue and can result in many disease problems. So C-reactive protein, as you notice, when you get an infection or an inflammation, you have the interleukin 6s and the interleukin 1 betas that are going to go and into the liver, and the liver is going to recognize these and produce CRP. So as I mentioned, plasma CRP is one test, a marker that they can test for pretty easily, that would indicate whether you are producing these interleukins or not. And if you are, then the result would be you have some kind of inflammation. But if you don't have an injury of any kind that you notice, then it would probably be chronic inflammation. And so that's a number and information that you really need information on, so you can determine, because again, if it's silent, you wouldn't ever know unless you got tested. So make sure that you or your parents or grandparents request that if when they get physicals. Now, when we get chronic inflammation, one of the big issues is oxidation. And oxidation is something that occurs, like it says there, rusting of iron, whenever there's oxygen involved, but some type of a stimulus that is going to cause a reaction with that oxygen. And I gave an example of iron in rusting. Basically, you lose an electron or lose electrons, and then combines with oxygen, ferrous oxide kind of a thing, and then you get rust. Well, in some sense, that's what can happen inside of the body with plasma membranes, with the lipids, and also proteins, and different things like that can result in causing the chronic inflammation. I want to give you an example of a lipid oxidation, and then later on, when we get to cardiovascular disease, we'll talk about how protein oxidation can lead to plaque formation. But just give me an example of oxidation. When fats oxidize, sometimes we call it rancidity. Uh, like when you have oil in the shelf, or you have those potato chips that you left on the top of the refrigerator for a long time. You take them out and they just taste a little off. They don't taste fresh. And then the oil kind of smells a little bit. I mean, it's been in the shelf exposed to oxygen, warm temperatures for a long time, and it just gets oxidized and it's just a little bit off. Um, Now, in lipid oxidation, you do have to begin with an unsaturated fatty acid. So there needs to be some double bonds there. So obviously the polyunsaturates would be the easier ones to oxidize because they have more double bonds. But what's going to happen is something is going to cause these fatty acids to lose an electron, and then that leads to an unstable electron configuration where it makes it reactive, and then it's going to, if oxygen's available, you'll form oxygen with the free radical and ultimately make what is called a hydroperoxide. Now this is different than hydrogen peroxide. This is a hydroperoxide, which basically leads to what we would consider rancidity. And I showed you the initiation, high heat, so anything that's cooked, has a lot of fat that's cooked and sits for a long time. Free radicals are what we're going to call reactive oxygen species, and obviously oxygen has to be available. And then we'll talk a little bit more about antioxidants later, but basically they are able to contribute an electron if the fatty acid would lose it and not allow oxidation to occur. So a lot of oxidation is manifested oftentimes by free radicals, and free radicals are uh, atoms that have unpaired electrons. As you hopefully have learned from chemistry, when energy levels are missing an electron, those atoms are very reactive. And so a free radical is something that is missing an electron, and so it is very reactive. It's seeking to become complete and seeking to get another electron, but it doesn't really share electrons. It basically steals those electrons, and then the other structure that it steals the electron from is now unstable and reacts and so forth and so on. So you can see that the free radicals can then set off a chain reaction by stealing electrons and making the other structure reactive and so forth. So it's a continuing basis that can go on and on. So reactive oxygen species is kind of a special free radical, if you will. It's basically a free radical that has oxygen as part of its structure. They call them reactive oxygen species. This is probably the most important type of free radical, if you will, in our bodies and dealing with nutrition. I mean, free radicals can be iron, they could be copper or something like that would be a catalyst for a reaction, or they can cause a reaction type of thing. So it could be a mineral, but in our case it's going to be more organic type of, not, I'm sorry, I didn't mean organic. It's going to be some bigger structure that contains oxygen. And yeah, I give you the types. I don't expect you to remember those types, but hydrogen peroxide, as you know, can cause oxidation. You put it on a wound and it kind of bubbles up and that kind of thing. But different things can cause this. But all of these are different kinds of reactive oxygen species. And that's kind of what I was hinting at, or kind of getting at, when we were talking about the phytochemicals, and we're talking that each individual phytochemical is a different antioxidant, because as you can see, there's many different kinds of reactive oxygen species that need to have an antioxidant. So they're all different. So we need the variety of foods to deal with those. And you can see what things could form free radicals or reactive oxygen species, smoking, air pollution, even the mitochondria produce hydrogen peroxide as a byproduct that need to be neutralized, or else they will oxidize inside your body. Um, and so there's lots of different things that can lead to free radicals or oxidation, ultimately possibly DNA damage, even your immune system. In phagocytosis, you'll notice down here under the killing, it will produce reactive oxygen species and nitric oxides, and you'll see where it is right in here as part of the killing process, because it will oxidize those organisms and degrade them, kind of thing. Um, but if these get out of hand, I mean, this is a result of a stimulation of your immune system, right? So if you have chronic what we're going to call pro-inflammatory things that you're doing to your body, then these will be produced a lot. And we'll talk about these phagocytosis, or what we're going to call macrophages, um, or scavenger cells later on when we get into heart disease and look at that. So reactive oxygen species, the aspects of them are they can lead to fatty acid oxidation, they can lead to amino acid oxidation. You can see all of this DNA damage and that kind of thing. The positive things is that, they can lead to cell suicide if you have a cancerous cell, possibly, and recruitment. So has a positive aspect to your immune system. But when the ROS get out of control and you get too many of them, then that can become a problem. Um, And here's some defenses that your body can use. These are all, vitamin E and C. These are all antioxidants. And then there's something, this is called superoxide dismutase, can also be a defense against reactive oxygen species that your body normally produces, kind of things. But anyway. But oxidative stress is something that you may hear down the road when you have an imbalance between pro-inflammatory things and anti-inflammatory things. So it's an imbalance of the pro-inflammatory intermediates and your body's ability to detoxify them. So you're doing something, or something's happening to increase the amount of pro-inflammatory intermediates, and then over the amount of anti-inflammatory intermediates that you could produce. So what needs to happen is we need to try to do things that will balance these out. And so we'll talk about those. So in oxidative rancidity, what we were just talking about is you need a double bond here, and you need some kind of a free radical. And that free radicals, you notice that this structure here does not have a missing electron anywhere. And it has a double bond, so it's unsaturated. And what will happen is, you notice we're losing a hydrogen, or basically losing an electron, which creates a free radical. This little dot is the free radical on this fatty acid. And so that is going to make this pretty reactive. It's going to want to complete its energy level. And in this case, what's going to happen is, if oxygen's available, then this free radical will combine with the oxygen and produce what is referred to as a peroxide. But you'll notice there's still a dot there, and that dot will then is still a free radical, and so will be reactive. And what it will do is react with hydrogen, or actually it will react with another fatty acid and steal its hydrogen, and create what is called a hydroperoxide. So this hydroperoxide then we would refer to as being rancidity. But as you notice, we talked earlier about a chain reaction. What this causes when you lose that hydrogen is a free radical on the other fatty acid. And so basically you go back to where you are and you basically just have a chain reaction that just works over and over and over and over again and creates more and more oxidation or rancidity. And so that can happen in food, but that could also happen inside of your body in plasma membranes and other structures that we'll talk about later. So that's kind of what's, an indicator of what oxidation is and what's happening and the how a free radical can cause that. And then I'm just giving you several pictures about what the ROS will affect. You can see it's affecting the mitochondrial DNA, but I don't know if you have heard about telomeres, but the little sections at the end of your chromosomes that dictate how many times you can divide. A cell can divide, but it also affects aging and that kind of thing. So you can see that that's affecting and shortening those telomeres. You can see protein degradation and all kinds of things that it will do. So it's pretty damaging. You can see the free radicals of the ROS can damage the cell membrane, making it less of a barrier and increasing the risk that carcinogens could get in, but basically oxidizing, if you will, your plasma membranes. So that's not a good thing. This is a neuron, as you can see, has its dendrites sticking out there, but you notice that we can have damaging of the nuclear DNA of your nervous system. So these ROS can, or sometimes referred to as oxygen radicals, can damage your nervous system and cause some issues with that too. And who knows, that may be the possibility of its relationship to Alzheimer's and that kind of thing. So reactive oxygen species is something we really need to be concerned in to try to take. Fat cells are living cells, and so when fat cells start increasing in size, so as you start becoming more and more obese, your fat cells will increase size, and they will start producing inflammatory signals. And so these signals can result in chronic inflammation because they will signal that something is inflamed. And here you can see as the fat cells get bigger. Here's the small fat cells, and we get obesity. We get bigger fat cells. You can see that we start producing inflammatory cytokines as a result of their increase in size. And then as we notice here, we're producing, remember we talked a little bit about some of the markers for chronic inflammation, interleukin 6, interleukin 1 beta, tumor necrosis factor, alpha. Those kind of things will be produced by weight gain and basically send out signals to your body that there's inflammation occurring. And so your body will start producing these as a result to try to resolve that inflammation, but it never happens. So obesity can increase chronic inflammation. It's a big factor in chronic inflammation. And people don't realize that fat cells are living cells and they do produce things. So what are some pro-inflammatory foods? Getting back to the nutrition piece, as you can see, these are foods that trigger prolonged or systemic inflammation. So we have refined sugars, and you can see that they increase the interleukin 6s and interleukin 1, tumor necrosis factor, CRP, and something advanced glycation in products, which can lead to inflammation. Saturated fats increase intensity and duration of inflammation. Trans fats, you can see omega-6s. So we'll talk about omega-6s where they're found in corn oil, and some of the vegetable and seed oils are not considered heart friendly. So we'll talk about that later. And then red meats increase interleukin 6. So these are referred to as pro-inflammatory foods. These are going to increase inflammation. The anti-inflammatory foods, as you might imagine, since we're brainwashing you this term into eating more plants, are foods that reduce inflammation. They're foods that are high in antioxidants. Fruits, vegetables will lower. Green teas, omega-3s, curcumin or turmeric is very good. And there's a whole list of them. But basically, what we talked about with the phytochemicals, they're deep colored foods that have a lot of color to them. And then the omega-3s, we've talked about those. And then don't forget your spices. Spices are full of phytochemicals. That. So just antioxidant, once again, is something that can give an electron to a free radical or reactive oxygen species, because again, a stable molecule is where all of its energy levels are full. If you lose an electron, then you become unstable and become what's referred to as a free radical. Well, antioxidants and vitamin C and E are some that can donate an electron to this unstable molecule without becoming a free radical themselves. And so they remain stable, but this becomes stable then, so it's not reactive, so you won't have the reaction with the fatty acids, with the proteins, the DNA, and so forth. So antioxidants the problem is we're not eating a lot of foods that are antioxidants. Here, and again, I don't expect you to remember this whole chart, but we can see these are antioxidant vitamins. Vitamin C is more in the serum, like it's a water-soluble vitamin, so it's more in your blood and stuff, whereas vitamin E and vitamin A, they're in fat, they're fat soluble, so especially vitamin E is important like in your plasma membranes. Here we have some minerals. We've talked about carotenoids and all of those, and we can see the flavonoids, the phenolic acids, these are things that are going to prevent oxidation and reduce reactive oxygen species and those kind of things. But you've got to get them from food. There's no support in any type of double-blind studies that taking an antioxidant pill is helpful. And it all goes back to what we talked about with the phytochemicals. We're talking about synergism, where you have the different nutrients and non-nutrients that work together within a food and cause a higher effect than by themselves. So just taking an antioxidant by itself is just not going to work. So choose real foods over pills, choose plant foods with a broad range of color, consume a diverse selection of plant foods, and consume minimal processed foods, especially with the trans fats and the saturated fats and those kind of things. There are several diet plans out there that you could investigate. There's the anti-inflammatory diet. That's been put together, but they all have a common theme. As we go through them, you'll notice that vegetables and fruits are at the base, which means we should get the most from them, and then go up the line from here. You can see the DASH diet is also part of this. We've introduced we've introduced the DASH diet, and you can see vegetables and fruits are on the bottom, so they all basically have a common theme. Here's the Mediterranean diet. You may have heard a lot about that. Now it's a little bit different, but still There's a limitation of meat. There's a limitation up here. There's lots of plant foods, but fruits and vegetables, legumes, just bright colors and things like that, whole grains, those kind of things. So a little bit different, um, but kind of the similar content. And then the Ornish diet, Dr. Ornish putting together again vegetables and fruits, and those are down at the bottom. So, so these are the anti-inflammatory um, food plans that you might consider. All right, so we'll spend some more time when we get into especially cardiovascular disease and look a little bit closer on how reactive oxygen species and free radicals and things like that can affect their formation of plaque. So we'll come back to this later.